Can you see the screen?
Yeah, I can see. How about the students? Students, can you see slides? Can anyone see the slides?
Yes.
Okay, okay,
Yes.
okay. Ashani, they can see. Okay, you can carry on.
Okay. Thank you, Sumita. I am Ashani Silva, and I am going to continue the IoT in telemedicine and security part. Use of IoT at a high scale in several healthcare treatment methods and equipment is communication between doctors and patients. First of all, let's see what is telemedicine. Telemedicine is a technology which allows healthcare professionals to evaluate and diagnose and treat patients at a distance using telecommunication technology. How is enabling the telemedicine of tomorrow? IoT is ushering in the future of telemedicine for real-time health monitoring, to preventive care, to empower our elders to receive better care at home. The future of IoT powered telemedicine holds promise. There are many ways in which the IoT can help in the growth of telemedicine by providing to healthcare centers with improved quality of care. This has turned out to be better and more convenient in several in-person treatment methods. Let's look at some examples. First one is helps doctors with accessing the important data from medical devices. The doctors can look at the wounds, rashes, or skin color and analyze the patient, but they can't check the blood pressure, heartbeat, and other related vitals. In these cases, IoT wearable devices plays an important role where the doctors can access important information through them. Some of the healthcare centers are even developing their own IoT wearable for their patients to monitor their health. Additionally, oximeters and digital stethoscopes are the IoT devices which used by the patients during the telemedicine consultation and virtual meetings. Second one is real-time monitoring. Real-time monitoring technology helps doctors to get patient's detail every second. Patients will hold the monitor device to monitor the abnormalities in their heartbeat. Development in technology has enabled people to take care of their health with IoT and telemedicine. Third one is help senior citizens. Several elderly people prefer to stay at home in their last days in place of shifting to assisted living facilities. However, aging without any assistant facilities and doing things on their own also requires being aware of the resources like home delivery meals, communities, social groups, emergency numbers, and knowledge about using certain devices. Now let's look at some of the trending use cases of IoT in telemedicine. First one is remote patient monitoring. Remote patient monitoring is one of the most popular terms making round on the IoT platforms in the telemedicine market. The entire idea behind this concept is to reduce the hospital stay, in-person visits, and the overall healthcare expenditure. It also helps the patients who are unable to reach the physicians due to long distance travels, poor health, or old age. This technology helps both patient and the doctors to monitor the patient's activities and its impact on their vitals. One is mobile health. It is needless to say that the innovation has turned up like a boon in the healthcare industry. The other convenience to keep a track of all the required vitals of the body and get the detailed report on your smart devices is one of the advanced development in the field. The technology is integrated with the wearable devices that are connected to the application installed on the user's device. This helps to control several critical situations where the patient requires immediate treatment. Third one is ingestible sensors. Many times, patients tend to forget the dose of the prescribed medicine or get careless about them. This aggravates the health concern and the treatment of the cosmetic impaired as well as the criticality of the illness. To avoid this scenario, ingestible sensors are discovered which goes inside the human system and stay at a particular spot. Then it can detect those taken and misplaced on the sensor. These smart pills also help to reduce those senseless consumptions of medicines, which sometimes can even turn out to be fatal or life-threatening. And these ingestible devices in the advanced versions are now also available with a camera attached to them, which gives the inner view of the body parts and the organs. So many advanced applications of IoT in telemedicine, there are certain drawbacks in the field that needs to attention. Let us have a look at the challenges in the industry. One thing is unauthorized accesses. If the system does not have a strong security module, it might allow hackers and other interpolers to get access to the doctors and patients' data. Needless to say, it can be dangerous as one may have ill intents behind the access. Another one is privacy concern. If a centralized system, even a single patient device, is hacked, all the data can be available for the misuse and even the hacking of the entire system. This uh, this would not just affect the patient's treatment, but it could also be very risky from the investment in the healthcare industry perspective. Another one is global healthcare policy. Currently, the healthcare policies around the world are in their transitional stages. In many states and countries, the healthcare centers and the governments are all uh, still following the outdated regulations, which create an obstruction in implementing the technology for the proper treatment and other procedures. Now let's see some advantages. First one is lesser no-show rate. Since the patients do not have to visit the clinic in person, it reduces the no-show rates caused due to busy lifestyles, bad weather, or poor health. Another one is gives a competitive edge to the companies over their competitors.
Hello.
Implementing the technology and
அங்கிள்
encouraging
சொல்லுங்க, குட் ஆஃப்டர்நூன் சொல்லுங்க.
your patients to adopt it definitely improves a
அக்ரிமெண்ட் செய்ய
company
போகிற
names,
லாயரா
brand names,
அர்ஜுன் என்று சொல்லி
company's brand name, and authenticity in
டிஎஸ்
the
ஆஃபீஸுக்கு
regional as well as
உள்ளுக்கே
the
இருக்குது.
global market. Another advantage is increased revenue.
ஓகே
Since
ஓகே.
technology
இப்போ
comes
வந்துட்டாங்க, இப்போ தான்
with
வந்தாங்க.
several
ஃபோன்
benefits
கொஞ்சம் பிரச்சனையாக
and
இருந்தது
less
போல 4:30க்கு
investment,
வர சொன்னாங்க
it
மொத்தம்.
usually turn out to give better
4:30க்கு
ROI to
வரேன் என்ன இப்போ நான்.
companies and hospitals.
ஓகே.
Another advantage is flexibility of working. The technology does not only give the patient a convenience to access the healthcare facilities from remote areas, but it also gives the doctors flexibility of uh, working and treating patients remotely without having to be present in the clinics all the time and make appointments. Another advantage is cost effective. The doctors can increase the number of appointments in a day and also scale up the patient count in general with lesser efforts and less time. Also, the patient has to pay comparatively less amount of money for the consultation than in-person visits. Another advantage is wider access to healthcare experts. Since the solution provides the list of specialists and physicians available for the consultation, it gives a wider range of healthcare professionals to the patients to choose from and get multiple opinions in one place. Another advantage is healthy healthcare staff has lesser direct exposure to illness. Since the physicians and nurses do not have to check the patients in person, they save themselves from direct exposure and maintain their own health. Now let's see the way secure healthcare IoT in IoT devices. Uh, the cybersecurity experts can take many actions to protect healthcare IoT securities, including these 5 steps. First step is inventory devices. Develop an exclusive map of all assets because healthcare organizations can't secure what they can't see. Many IoT devices are brought in without a risk assessment because they provide value. Second step is follow standard best practices. Experts must follow general security best practices for healthcare IoT devices. Deploy devices to understand what vulnerabilities exist and monitor network traffic for anything out of the norm using behavioral analytics profiling. And also, devices and software should be updated regularly. Third point is implement effective authentication. Deploying public key digital certificates can authenticate connections with the network, other devices, and the electronic health record system, and ensure data packets are not manipulated while in the transit from man-in-the-middle attacks. Fourth step is segment network. Administrators must insulate devices that don't have built-in controls. If a device must be used for patient care, admins can turn off its compatibility to connect to the network. If the device must connect, healthcare organizations can work with the vendor to identify where the device needs to be and only allow those connections using an allowing. Fifth one is use the right tools. Healthcare organization can use tools that simplify IoT security. Platforms automate the management of massive amount of data and devices and can control authentication security. Manufacturers have also developed medical device tools that can identify what a device is, what data is collected from it, and where it's connect to the internet. IoT analytics platform can help administrators to monitor network traffic and approve or any connection. Now let's see what are the main vulnerabilities in healthcare IoT. Connected devices in healthcare. Some cases, but the same devices pose increased risk to both privacy and security. Some other possible risks include attacks on the other system. Another one is risk to personal safety. Another one is privacy risk. Rather than that, vulnerabilities, let's look at some more. First one is risk of patient's privacy exposure. The primary privacy issue is to keep the patient's personal health records confidential. Personal health records are drawn from multiple sources and are reported directly to the e-health center. Containing personal information, they can become the target for cyber attacks, ending in the exposure of private data. Another one is data irrespective. Generally, the data of patients are available only to authorized owners. However, such data can be erased by going over the wireless limit. Another one is ownership of data. Countries have laws to protect patients' data, but they may vary from state to state. Besides, in certain cases, such as in case with fitness wearables, many people would think that the data tracked and collected is be bound to be protected by legislation, but in many cases it is not. Another vulnerability is location privacy. Location privacy is connected with eavesdropping on a patient's location. Location privacy in WSN specifically hiding the message sender's location can be achieved through routing to a random selected immediate node. Now let's see who is responsible for these. In healthcare facilities, increasingly rely on devices that connected with each other with the hospital medical record systems and with the internet, raising concerns about the vulnerabilities of medical devices. The major concern with this discovery was that these devices were connected to the internet through the computers running very old versions of Windows XP, known for lots of exploitable vulnerabilities. Taking into account the complexity of the problem and the number of people involved, it should be tackled on all levels from the individual staff members to government. Now let's look at the responsibility area. First one is employees. There is need to educate employees on the acceptable and secure way of using medical devices. Currently, a lot of cases of issues stem from employee unaware of sound security practices and not from international acts to impact our or disable connected medical devices. For example, employee need to realize that medical devices, even having a browser, cannot be used to host websites or stream music. Second one is healthcare organization. Healthcare organizations should increase their focus on security as medical devices become increasingly connected. Once a medical device is reachable via the internet, healthcare organizations need to watch out for a potential hazard and propagation of malware. They should also ensure that connected medical devices have the latest software version. Any update of a critical medical device must ensure that it doesn't cause any unknown problems that may unknowingly harm to a patient. Third one is provider of cloud services. While healthcare organizations make sure that the sensitivity data is stored in a secure and encrypted manner, they don't have control over the security of the data access points being used to transmit the data. This creates a significant threat that increasingly gradually based on the number of new devices connected to the internet and should be addressed by communication and data storage providers. Fourth one is regulatory bodies. The primary concern for regulatory bodies is the security of personal health information stored and carried through connected devices. For this, they need to provide an adequate and consistent legislation. Now let's see what can be done. Ensuring security in the healthcare IoT requires the joint effort from the providers and manufacturers of IoT devices and healthcare organizations. There are several basic security actions that can be taken at the stage of designing and production of the medical connected devices. First one is authentication. Manufacturers need to issue certificates for healthcare devices that validate identities to make sure only authorized users, users or services have access to the devices. Second one is encryption. Certificates create an encrypted link and allow healthcare information to be transmitted privately. Third one is integrity. Certificates sign messages into medical devices to make sure the main unaltered and are encrypted. These are the references I use. You can refer those. As Sunita mentioned, we have our own YouTube channel and WhatsApp group. You can subscribe us via YouTube and improve your knowledge. And we have our own WhatsApp group which we update more recent information through that. So you can join us with that also. Our team member will share all the links, and also we have our own Facebook page group. You can join with that also. For more information on this topic and other related matters on healthcare and biomedical engineering, You can contact us with these below platforms. Apart from the platforms I have mentioned earlier, we are active in other platforms as well. And that's all about my part. If you have any questions,
Students, you can ask any questions from Shani's part. Any questions? Okay, I guess there are no questions. Okay, so in that case, let me conclude the session. So today we had a session on IoT applications in the healthcare industry. So I explained about what is IoT and the definition and how the IoT is applied, what are the benefits and challenges. And my second speaker talked about some prominent applications in the industry. And my third speaker talked about telemedicine and the security issues we face in the concept of IoT. So these are the contents we would like to deliver today. So since there are no questions, we would like to hand over the session to Reshma madam. Over to you, madam.
Okay. So thank you for your session, and thank you so much for taking your time to enlighten your students about IoT. I think it would really help our students to do their projects and the related research in this area. So thank you all. I thank all the three for giving your time and your energy for hosting such a session.
Thank you,
Thank
ma'am.
you.
Thank you, ma'am. And we would like to join hand with you, and in future we would like to keep in touch with you. So the students
Okay,
also
sure,
can
sure.
contact with us easily via our WhatsApp group and the Facebook groups. So we would like
Okay.
to ask the students to join, and please subscribe our YouTube channel and keep supporting us, guys, please.
Okay. So thank you once more.
Thank you so much, ma'am, for giving us this opportunity. So since there is no any questions, so let's end up this session.
Okay. Thank
Okay,
you.
thank you so much. Thank you so much, students. Okay, bye bye.